Welcome and thank you for joining us for today's E-Referrals to the Sydney Local Health District Healthlink Smartforms webinar. My name is Alex Dolezal and I am the team leader for Digital Health and Quality Improvement Project. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. We recognize their continuing connection to land, water and community and pay respects to elders past, present and emerging. We also extend that respect to any Aboriginal colleagues who may be joining us today. Please note that this webinar will be recorded and will be available on our YouTube channel within the next couple of days. The participant evaluation survey link will pop up on your screens at the end of the webinar. We appreciate your feedback. Please complete this to allow us to improve the program. Please ensure that you submit your questions to the speaker in the question and answer box throughout the presentation. To view this box, hover over the toolbar at the bottom of your screen. Today, we have two speakers. Our first speaker is Paul Bennett, the Program Manager of Health Pathways Sydney and Sydney Local Health District GP E-Referral Project. With over 30 years experience as a registered nurse and HealthLink manager in the United Kingdom and Australia, Paul has been the manager of the highly successful Health Pathways Sydney program supporting general practice since 2013 and is also responsible for the delivery of electronic GP referral systems to the Sydney Local Health District hospitals and services. Our second speaker is Sarah Friend, E-Referral Project Officer at Sydney Local Health District. Sarah is a registered nurse and has been working on the E-Referral project since its inception, trialing different general practice and service referral products. The first presentation is by Paul, followed by Sarah.
Thank you, Alex, for that introduction. In fact, Sarah and I will play a bit of tag team as we go through our presentation. Just to start off, I'd just like to second Alex's acknowledgement to country and pay my respects to elders past, present and emerging of all the lands in which we meet today. So thank you very much for the opportunity to come and speak to you this evening and highlight the work that Sarah and I in Sydney Local Health District with the support of the Central and Eastern Sydney PHN has been undertaking in bringing electronic referral processes to Sydney LHD ambulatory care services. So next slide, please. Thanks, Sarah. So we've been undertaking some exploratory work for a number of years. So in the end of 2017, we began looking at a number of options to improve referral processes into Sydney Local Health District, realizing that there was a great thirst to move away from fax and paper-based referral processes into our outpatient services and our specialist services. And through a number of various trials using a number of different products, Sydney Local Health District has chosen to use Healthlink as its carrier and as its e-referral platform. So there was a number of reasons for doing that. Number one being the familiarity with lots of general practice in using Healthlink Smartforms, particularly to roads and maritime services and now into my aged care, and even to local other services such as Chris O'Brien Lifehouse. So it was a tool that was abundantly available through all of the main general practice software, such as Medical Director, Best Practice, Genie, and a number of specialist practices as well. And because of that familiarity of use and the simplicity of the system and the long-standing relationship Sydney LHD has had with Healthlink and using it as its secure messaging vendor for our discharge letters and some outgoing pathology and radiology, it made sense that this was the most appropriate tool for us to use in the central Sydney region. Some of the key factors as well was the fact that its integration into GP software meant that there was a lot of auto-population, particularly of patient demographic and clinical information was there as an added bonus, and the fact that it would provide accurate information from when record system into the hospital, as well as time efficiencies and the reduction in the need to print paper and for sign off and faxing, etc. on the GP side. The other benefits is that it facilitates a two-way communication with a built-in referral notification period at both sides, as well as acknowledgement and confirmation of triage outcomes back to general practice. Next slide, please, Sarah. So as I said, we've been working for over a number of years, bringing on Healthlink Smartforms. So where we are now to date, we have Smartforms available across all of our services or facilities, but not yet all of our services. And we're on a 3-year mission to really bring all of Sydney LHD onto Healthlink and onto Smartforms to reduce the need for fax and paper referrals moving forward. So without going through this fairly extensive list, these are all services that are currently accessible via Healthlink from your practice software or via the Healthlink portal for those that don't have it integrated into their practice software. We'll talk more about that a bit later. The lion's share of services that are already connected came on board October of last year at Concord. And what we've seen with that is a definite thirst to use those forms and into referring to the services, particularly for general practice in the Strathfield, Concord, and I suppose the more western edge of Sydney local health district. And as each month has gone on, the number of referrals as into each of those services has increased, as has the number of general practitioners that are utilising the service straight from their practice software. So there is a range of ambulatory services at Royal Prince Alfred Hospital, as well as some community services for community podiatry and paediatrics and child development services, as well as the COVID-19 monitoring form into the RPA virtual hospital as well. Next slide, please, Sarah. So moving forward, as I said, we've got a lot of services already connected, but I said we're on a mission to bring all of the districts online with electronic referral over the next couple of years. Coming in mid-October, general practitioners will be able to make direct electronic referral to a range of services at Royal Prince Alfred Hospital, from clinical genetics to sleep, respiratory, immunology, hand therapy, that's the physio and OT services. Our long-standing hematology form at RPA is one of the original forms, is going to go through a form rebuild, as well as services such as pediatrics, dermatology, and urology will all be accessible through there. The other really exciting development is we've been very much providing electronic referral, I suppose, in isolation as a district, but New South Wales Health and eHealth New South Wales have embarked on a project to actually build a state receiving platform. And that platform, called Engage Outpatients, will be a local service level application and platform that will take not only electronic referrals, but it'll have the ability to digitize fax referrals, and for paper referrals, so they still be coming through to be scanned in. And not only services, but hospitals, local health districts, and even at state level will have a one platform where all of that referral information will sit. At the moment, it's very disparate. There are different platforms and forms of record keeping for referral kind of progress, how long has a referral being active, sitting on waiting lists. And the pilot is going to bring that one-stop shop in terms of the districts and being able to control and manage and benchmark their referral management processes. So ourselves in Northern New South Wales are the two pilot sites, and so by the end of this year, we are hoping that and aiming that all antenatal and maternity referrals to Canterbury Hospital and Royal Prince Alfred Hospital will be using Healthlink Smartforms, and they will feed into the new state's referral management platform. All the responses will still be at local level, so it'll be seamless in that communication, and it'll actually give us an enhanced level of communication where we'll be able to start communicating digitally out to patients as well. The other services coming onto that will be fertility at RPA and gynecology at RPA. As we move then early into next year, we're also bringing on a range of other RPA services, particularly endocrinology and diabetes, aged care, and we're doing some reconfiguration of some of our existing osteoporosis forms as well. And then a range of other more complex forms that we're building for neurosurgery, pain across the district, rehabilitation, plastics, hand surgery, etc., as well as a few we need to go back and revise, such as sleep services at Concord Hospital. And so midway through 2022, the lion's share of the district's ambulatory care services will be accessible to general practice for referrals straight from your practice software or the Healthlink portal. Next slide, please, Sarah. And I'm actually going to hand you over to Sarah now to run through how to use the Healthlink platform from the general practice perspective, and then how that works and what happens to those referrals as they come through to the district. Sarah.
Thank you, Paul. So this evening I'll be demonstrating how to access the Healthlink Smartforms, how to complete and submit a referral to Sydney Local Health District, and also just to give you an overview of the process to obtain feedback at the completion of triage on the hospital side. So just to provide a bit of context on how you access the Healthlink Smartform. So for best practice users, within the patient file, you select the piece of paper, so the letter. The word processor window will appear. By selecting the Healthlink icon, the Healthlink Forms window will also pop up. Within that window, also keep a record of any referrals for that particular patient you've sent to Sydney Local Health District or any other service that's receiving Healthlink Smartforms. For Genie users, within the patient file, you select Tools from the top left-hand side of the menu and select Healthlink Online. Medical Director users, also within the patient file, you select the Healthlink tab. That will also, similar to best practice, display a record of any referrals you've sent for that patient using Healthlink Smartforms. And then to send a Smartform, you select New Form. As Paul mentioned, there also is a Healthlink portal. So this enables GPs, allied health practitioners, or any other providers that don't have best practice Genie or medical director, allows them to send Smartforms to any Healthlink customer, including Sydney Local Health District. And that can be done by just selecting the letter writer. So once Healthlink has opened, this window will appear, which is the Healthlink referred services. Sydney Local Health District is where all of our forms will be displayed. So for Concord, Balmain, RPA, Canterbury, and so on. You'll also see other services that you may have access to. For Sydney Local Health District, our forms are only displayed within the Central and Eastern Sydney Primary Health Network catchment area. So if you're within that region, you may also see forms like My Aged Care, the Transport New South Wales, Chris O'Brien Lifehouse, and also CC Chip. So I'm now just going to jump in to provide you a demonstration. So at selecting Sydney Local Health District, a list of all of our available services will appear. And I should say that on the previous page, there also is an option to refer to specialists that also receive Healthlink as well, which does include a number of our VMOs. So our service list appears, and you can see a number of different services. By selecting on a service, the corresponding facility will also appear. Any service that does have a plus icon next to the name just indicates that there's a number of forms that are associated with that service that you can select. So this evening I'll be demonstrating the cardiology form, which is currently available at Concord Hospital. So once you select the facility, you then click Continue. and the Healthlink form will load. So for anyone who's not familiar with the Healthlink form, it does comprise of the 6 referral tabs you can see on the left-hand side. So the first tab is what we're looking at the moment, has all the information that's been designed by Sydney Local Health District, including specialist names, any other particular information we require. And the remaining fields from attachments and reports onwards are predominantly auto-populated from your clinical software if you're using Best Practice Genie or Medical Director. So anything with a red asterisk next to the field indicates it's a mandatory field. You can select a named clinician. There will be also some auto-population on the form, including referral date. And also there's some auto-defaulting. So you may see that the referral continuation field is defaulted to new just by selecting the opposite field. You can change that field over. Referral period, there's auto-population regarding interpreter required, and the preferred language will also pull across onto the form. So for referrals that are urgent, we have implemented this field in most of our forms. So what's required is that the on-call clinician for this particular service must be contacted first. And then what you can do is note in the referral who you discuss the referral with, the date, time, and outcome. And the intention of this field is to ensure that when referrals are urgent, that they're flagged with the service, and then that way we are retrieving them urgently from the system to start that triage process. So for most of the Sydney Local Health District forms, there will be a free text reason for referral. The referral we're looking at the moment is a standardised form. We do have some forms that are very customised, including the positive FOBT assessment form for direct access colonoscopy. But what you can do here is just enter your reason for referral. You can also browse for through your consultation notes and attach a particular note that's relevant. I should also note that this is a test environment. I'm not using any real patient data or a patient file. To make our way through the referral, there's some fields regarding applicability for telehealth consultation. You can also indicate if the patient does have any reasonable adjustments required for disability or any special needs, they can be entered here. And a newly introduced field, is does the patient have a carer or support person? So here you can include up to 2 carer or support persons, and also nominate if they're the primary point of contact for the patient. We have a link to health pathways as well, where you can look up information about the service or particular conditions. And finally, at the lower half of the screen, you can see the measurement details table. So this will auto-populate from your practice software. My Healthlink portal users would have to manually enter these if it was relevant. But if it hasn't come across or you'd like to update the field, you can change the values or the dates by selecting the field. Moving on to the next tab, which is attachments and reports. This is where you can attach any supporting documentation with your referral. So whether that's pathology results, radiology reports, care plans, etc. The table here will give you a snapshot of a number of files within a certain time frame. However, if you cannot see the file that you're after, you can browse for patient document. What this will do is it will interrogate your practice software within the patient file. You can change the date range and then select the file that's relevant. Also, if the file isn't available within your practice software, you can browse for a local file that may be stored on your computer. So when you would like to attach a file, you simply just select here on the left-hand side, and that will attach the file to the referral. You can also preview the file by selecting this icon here. How you know that the file is attached is in the tab. You can now see it says 2 reports selected. Medications and warnings is largely auto-populated from your clinical software. So for anything that's not relevant, you can remove it here. Alternatively, you can also add any medications that are not listed. Medical history is also auto-populated from your clinical software. So to select multiple files, you can auto select everything by clicking up the top, or alternatively, you're just manually selecting what is relevant for the referral. Patient information is also auto-populated from your clinical software. So all the important demographics, date of birth, name, gender, Indigenous status, address, etc., all included. If the patient is not eligible for Medicare or DVA, which are our primary identifiers used, at least in the identification of the patient when it's received on our hospital side, you can select no, and you just have to enter a reason as to why. But all of the information will come across from your software, and you hopefully shouldn't have to enter any information in here. The same with the final tab, which is referrer information. This is where your provider number, HPI and HPIO will be auto-populated, and also including your practice and your own details as well. So when you're ready to submit the referral, you can select submit, and that will send the referral to Sydney LHD. You can preview the form, and you can also park the form if you're not ready to send it to the service. So I'll click submit, and if I've missed any mandatory fields, I'll be prompted to complete them before the referral can be submitted. But what you'll see now is some red text that's on the top left-hand side of the screen. So this is the first acknowledgement you get that the referral has been sent, and it's now been received by Sydney Local Health District. So this is the system acknowledgement, and I'll cover off in a second where copies of the referral will live after it's been submitted. But what happens now on the hospital side is once you've submitted that referral, the clinic staff within, say, cardiology in this instance, would receive a notification. The referral would then go through the normal triage process. And if there's further information requested, you may receive a status update requesting additional information to be sent through. Alternatively, you'll just get an accepted notification coming back or a not accepted message. So the service staff have the ability to put some detail within the message that they send back to you. So we do encourage the services to include the appointment date, the time, and any other information that's relevant. These messages will go back into your practice software as well. It doesn't replace the service contacting the patient. The process of booking appointments, changing appointment date and times, and that usual liaison with the patient continues as per usual. It's just providing you with an acknowledgement that the referral has been processed. So just to cover off now, the location of status updates as per the different software providers. So status updates and requests for further information are received in all three GP softwares and also the My Healthlink portal. If you are asked to provide additional information, the current process is that you would resubmit a referral. You can also highlight that it's a continuation referral or just in response to additional information requested within the body of the referral. Copies of the smart form are stored in each of the softwares. And the other thing to know is for medical director users, you do get a note that's within your progress notes that you have submitted a Healthlink form. And over to you, Paul.
Sorry, I couldn't unmute then. Thank you, Sarah, for that. In terms of support from the district, there are a number of avenues should you encounter any difficulties or you want more information on using the system. So number one, that's Healthlink themselves, and they're available normally Monday to Friday, standard office hours, as are Sarah and myself, and we're available either through the email address that's up on the screen or from either of those mobiles to be contacted. And plus we've got the great support of Alex and the rest of the digital health team and QI team at Central Sydney Primary Health Network, who can offer also support with there are any issues using Healthlink. And if there are issues just with referrals that have been made, obviously we would encourage you to contact those services. But the great thing is that when you do that, you actually can use that acknowledgement number that you receive on submitting that referral, and the staff can now look onto the Healthlink dashboard at the service end to kind of find that referral, provide you any updates that you haven't received electronically on that. So that's good. We've got lots of resources on the PHN's digital health website. There's a full range of all the quick start guides for the various GP software types and using Healthlink, as well as the Healthlink web portal as well. So from that, next slide, please, Sarah. And I just thought I'd touch on some additional work that we are doing, and that's in the secure messaging space. We are certainly encouraging, as an organisation, all of our VMOs to move towards using secure messaging into their private rooms, and that's certainly a number that is increasing. And from the Health Pathways perspective, we are trying to identify and within the service details and the private room details, those EDIs for Healthlink VMOs, so to make life easier than that. And we are looking at services for enhanced communication, secure communication with general practice, that individual service groups will adopt secure messaging as well. So a good example will be our GP can share clinical nurse specialists who are now able to communicate on the progress of patients with cancer diagnoses, provide updates from MDTs, etc., straight into your GP software using secure messaging. So that's a great enhancement, and it'll hopefully fill in those gaps in that cancer journey with more accurate information and timely information with that patient journey from that. And next slide, Sarah. And I suppose just to re-emphasize that we build in the pathways as the electronic forms and trying to keep them aligned, particularly some of those forms that have key clinical indicators and criteria. All of that is aligned then with the content on Health Pathways. So it's been vital that we've kept the two together in tandem from there. And Alex, back to you.
Thank you, Paul, and thank you, Sarah. We already have questions coming through in the Q&A.
Great.
The first question is, will this electronic referral system be extended to other local health districts?
Okay, a good question. And at this point in time in New South Wales, so ourselves in Sydney, Northern New South Wales are also using Healthlink, and we gather that Northern Sydney are on their way. They've embarked on that journey to start using Healthlink as their e-referral tool of choice. Hunter New England already use a different system, which will be compatible, as is Healthlink, with the state system that's going to be rolled out. And it'll be down to the individual local health districts what platform they adopt and when they adopt it. It is likely that they will all move down that road, but there's no time frame. And a lot of them are currently waiting for the completion or the first iteration of the state platform, receiving platform, to be developed. So once that's happened, then I think we'll see a lot more LHDs going down that road and beginning that journey. So,
thank you, Paul. And the extension of this question is, can GPs who practice just outside of Sydney Local Health District can use the system?
Yes, they can. So as Sarah said, it's accessible to everybody that's in the Central Eastern Sydney PHN. We've opened the eligibility up to all the GPs because we know that patients don't always stick within the boundaries. They may see a GP in Botany, for instance, or in the eastern suburbs, because they've had that long-term relationship, yet they may reside within Sydney LHD. So it's one of those indicators that if the patient resides within that area, yes, they're eligible. But as we're also a tertiary service provider, it may be the case that it is more appropriate that that patient, even if they're outside of the area, is referred through to that tertiary service. And that will be judged on merits then by the receiving team, as it would be as if you fax that referral through. So it'll be given due diligence to that need for clinical service.
Thanks, Paul. The next question is, what challenges did you face working with hospital systems, and most importantly, change management from each department ward?
Oh, do you want to take this one, Sarah?
We had great engagement with the departments. I think they're really enthusiastic about improving the way they manage referrals, and in particular providing updates and communication back to GPs. Paul and I have periodically met with different departments, and as we start to roll out e-referral to more and more services, we're not receiving any resistance, and there is a lot of change management, I guess, to manage the number of referrals that are coming through electronic referral and also fax. But hopefully, as we start to see the shift to e-referral processes, we'll start to minimise, I guess, the load that's coming through via fax and the separate processes that are having to be managed at the moment with the two pathways into the services.
I think they've seen it as an extension of the work we've done over the last 8 years with Health Pathways and continue to do. So the mere fact that we got all of those services to sit down and kind of want to work with general practice and build better relationships and better understanding through the pathways model has certainly helped this, and they're seeing it as a way of enhancing that relationship. I think gone are the days where it was very much where the hospital, you're the GP. I think a lot of barriers are certainly being broken down with this, and they have suffered for many years with the issues of fax and things not coming through properly, delays in receiving, and so they truly see the benefits of electronic referral and secure messaging, and just think it's fantastic. They really do, and they're impressed with the quality of referrals that come through, because, and even from an admin perspective at the hospital side, to have all of that patient demographics, where the need for translator identified early on in the process is godsend. Really is fantastic information that comes through. So
thank you, Paul and Sarah. I've got another question saying, can you show us how to refer patients to Sydney Local Health mental health services? For example, psychological support services, etc. So psychological support services is actually a Central and Eastern Sydney PHN initiative. And to be totally honest, I can tell you that about 9 different PHN having psychological support services are at the moment talking to Healthlink about developing a PSS smartphone, but I don't have an exact timeline on it. I believe it should be happening towards the end of the year, but as you know, with COVID, etc., that's not certain. I do know that there's 9 other PHNs involved, not just Central and Eastern Sydney PHN. Paul and Sarah, can you talk a little bit more about the mental health services in Sydney Local Health District?
I can, thank you, Alex. So for acute mental health services, they didn't actually show up on that slide, but they are certainly on the roadmap for late 2022. We're not sure of the approach we're going to take with them in how we develop forms, whether that's one single form, whether that's a multitude of forms for all of the various service types. We've certainly had some conversations just around eating disorders specifically into the Peter Beaumont unit. So that's ongoing. At the moment, the only district service that is available via Healthlink is the CC CHIP. So that's the Collaborative Centre for Cardiometabolic Health out of Concord and RPA Charles Perkins unit, and that's for patients, the physical management of patients with long-term chronic mental illness, and those are patients that are generally known to the system. So a lot of the referrals that GPs make for that will be for patients with a long history and a long association to our community mental health team. There are a number of practices that have been participating in an extended trial of using Healthlink into that service. So I think in the village at Summerhill being one of the services that's still making referrals through to the CC chip service. But that will be end of next year, almost into 2023, as we kind of work out the most appropriate kind of form build for that service. A great question, thank you.
Thank you, Paul. Next question is, what about if the specialist is also in private practice?
Okay. So the options there is where you think the most appropriate location for that service is. So on the forms, we have a mixture of staff specialists as named referrals and VMOs on those forms. Some of the forms actually indicate whether it is a private referral or not. A good example would be andrology, where we indicate not only the clinical subspecialty of the specialist, of the named person, but whether they see private or public only, etc. So they can make on that. There are some changes that are being worked through by the ministry right across the different local health districts on the naming procedure, whether at the moment, a lot of our forms, we will have the names of the specialists, but it may be the case that you've never engaged with that service, so you can actually choose a no preference option. And then that referral, when received, will be farmed out either to the on-call person for that week within that specialty, or to the most appropriate specialist within that speciality. We are moving to removing the no preference, where it will be the name of the department will figure, because that seems to align more with the latest interpretation by New South Wales Health of the Medicare billing rules. But that's a space that we're constantly monitoring where we go with that. But a number of the Concord services are private providers functioning within that public setting. So I suppose we're agnostic with that, but where there are private rooms, we would encourage secure messaging.
Thank you, Paul. And we've got the last question, and the question is a bit longer. Is the availability of a particular service is hard to identify from RPAH, Royal Prince Alfred Hospital website. I guess it's therefore obvious that the presence of a referral pathway indicates availability. How do non-clinical personnel triage, or are there clinical people at the triage end? Thank you.
Okay, so yes, the mere fact that there is a triage form means that there is a service that is receiving public referrals at that other end. So, and obviously this will be the point where I say, don't forget to check on health pathways as well. We're still not there in fully mapping out all of the LHD services, but if there is a specific form, that means there is a receiving service that will obviously manage your patient for you as appropriately referred. What was the second part of the question, Alex? Sorry. Oh, about triage. So across the district, there are a variety of triage processes. So all referrals should be clinically triaged by a specialist for that department. So some departments have almost a pre-triage just to verify location, geography, eligibility for that service. There may be senior nurse triage as well as part of that, working with the medical specialist. So, but all referrals for a clinical decision are managed by a specialist.
Thank you, Paul. And the last question just came through, and it is, are specialist letters going to be sent electronically or text or mailed like in the past?
The move from the districts, and there's a couple of different things happening, is for that to all be electronically, and that's providing there is an electronic receiving point for us to send out to. There are the main things is the district is changing some of the ways that it actually does its clinic letters and transcribing services to actually reduce the time that that's taken to make that more enhanced. And that's also going to involve short letters. So at point of care, so a patient presents at clinic, has their appointment, the specialist will be able to do a very short clinic note, which will actually be sent out at that point in time, just to say, hey, I've changed that medication, full letter to come, etc. So rather than waiting that week to 2 weeks for the full letter and those changes, you'll be notified on the day. So there's some work happening there with a couple of departments. The advent of the state builds, the engage outpatients, is certainly considering in the third wave of the work that's being done there. That's because this will be fully integrated into the hospital's medical record. It'll have their ability to be the carrier for outgoing clinic letters, but that's a future build. But the district itself is looking at other means to certainly move to all electronic. At this moment, we're aware that not every general practice has fully integrated systems themselves, so we'll continue to use a couple of mediums to get those discharge and clinic letters out there. So, which may include snail mail at this point in time.
Thank you, Paul. Thank you for all the questions. Before we close and do evaluation, I'd just like to add that 95% of our general practices which have computerized system do have some sort of secure messaging, most likely Healthlink. And if you are not computerized, not using clinical information software like Best Practice Medical Director, but still do have access to internet connected device, you can register for My Healthlink portal. That's totally for free, doesn't cost you anything. And you can start receiving electronic correspondence. And in fact, we started reaching to those general practices which are not using clinical information systems and offer them registering for the My Healthlink portal, just so that they can take advantage of receiving correspondence electronically. This brings me to a close. Thank you to our speaker and thank you to everyone attending. Do not hesitate to contact us for any assistance with electronic referrals to the Sydney local